Benefits of prior authorization approval in healthcare management. Hey doctors, welcome to today's video. If you've been practicing in the US healthcare system for any amount of time, you've likely dealt with prior authorization, or PA. It's often seen as just another regulatory hurdle, but when managed correctly, it actually offers some solid benefits for both you and your patients. I know what you're probably thinking. Prior authorization can be time-consuming, frustrating, and honestly, a bit of a headache. But if it's integrated into a well-organized workflow, it can really enhance the care you provide, reduce inefficiencies, and make sure things stay compliant on the administrative side. The main purpose of prior authorization is simple. Before delivering certain services or treatments, you need approval from a patient's insurance plan. The goal is to make sure the service is medically necessary, aligns with the patient's coverage, and prevents unnecessary treatments. I'm sure you're already aware, but while this extra step does add some administrative work, the aim is to strike a balance between clinical needs and cost-effectiveness. And when managed well, it helps streamline care, ensure proper documentation, and avoid potential roadblocks down the line. Now, let's talk about the benefits of prior authorization. Yes, it can be time-consuming, but if you approach it with structure and support, the results are worth it. By preventing unnecessary or duplicated services, prior authorization helps keep overall healthcare expenses in check. Having to submit documentation and get approval before proceeding ensures that a thorough review is done before starting specific treatments. And, of course, policy alignment is key. It ensures the treatment you plan to provide is actually covered under the patient's health plan, saving everyone time and confusion. Because it requires you to submit up-to-date patient history and assessments, it forces you to make sure your records are current and complete before treatment begins. Finally, there's risk reduction. By having a documented justification for each care decision, it reduces the chances of legal disputes down the road. So, while it can seem like a bit of extra work, these outcomes really benefit not only insurers but you as healthcare providers too. After all, you're responsible for both patient care and operational performance. This led to repeated rejections, resubmissions, and unhappy patients waiting longer for care. But then, the clinic decided to outsource the prior authorization process to an external partner, and the difference was immediate. Approvals became faster, documentation was more accurate, and denials dropped significantly. The clinical staff could finally focus on patient care, and administrative workflows became more predictable and efficient. Now, you might be wondering, how can you make this process smoother for your own practice? Well, this is where Staffingly comes in. We specialize in healthcare administrative operations, including prior authorization workflows. Here's how we do it. Our expert authorization teams handle insurer communications, documentation, and status tracking. We also stay on top of timely follow-ups with payers, so you don't have to worry about delays or missed updates. Plus, we integrate smoothly with your existing systems, giving you real-time visibility and keeping everything coordinated. And, with our proactive checks and standardization, we reduce denials and resubmissions. You can trust that your authorization requests will be processed quickly and accurately, saving you time and effort in the long run. We'll make the process easier, faster, and more efficient, helping you get your patients the care they need, when they need it. If you found this video helpful, be sure to like, subscribe, and follow for more tips on how to streamline your practice and improve patient care. Thanks for watching, doctors.